So my name is Alexandre Hirayama. I'm a research associate at Fred Hutch and an attending physician at Seattle Cancer Care Alliance. And this year in ASH, I'm presenting two posters that have the same end goal of understanding and improving CAR T-cell therapy. The second poster, it's a poster looking at NECTAR-255, which is a new immunotherapy drug. It's a polymer conjugated recombinant human interleukin-15. And we look at the effect of NECTAR-255 in 8 patients that received CAR T-cell therapy and relapsed or progressed and were enrolled in this ongoing phase 1 study, the first in human, look at NECTAR-255 in patients with relapse or refractory hematologic malignancies. And in this work, we showed that patients that had detected CAR T cells at the time that they received the first nectar infusion, they all had increase in CAR T cell numbers after one infusion of NECTAR-255. And even for the patients that didn't have any CAR T cells detected, we saw an increase in CD8 T cells, an increase in proliferation of CD8 T cells, meaning that NECTAR-255 could be a potential means of improving and augmenting CAR T-cell therapy. So based on these studies, we are planning to start a clinical trial with combination of CD19 CAR T cells and NECTAR-255 in patients with large B-cell lymphoma at our institution. For the first poster, the first presentation, the first work, the end game there is to try to find characteristics of the infused CAR T cells that are associated with outcomes, for example, with deep remissions, with durable remissions. So we're hoping to find signatures or some genetic signatures that could be altered to improve the next generations of CAR T cell therapy for patients with CLL and other B-cell malignancies as well. For the second work, like I mentioned, CAR T cells in general, they're really effective, so they change the outcomes of patients with B-cell malignancies with multiple myeloma, but unfortunately, most patients will eventually relapse. So we need additional therapies, we need to improve our current approach to CAR T cell therapy. So NECTAR-255 could potentially change the outcomes of these patients. So that's why we designed this clinical trial to look at the combination of the commercial CD19 CAR T cells with this new immunotherapy drug, hoping that we can improve the remissions and extend remissions for these patients. We have a lot of interesting CAR T cell abstracts. I think the community in general, they're looking for the abstracts that look at CAR T cells versus standard treatment. For example, for large B-cell lymphoma patients, we have like 3 clinical trials that looked at CAR T cells versus standard treatment with chemotherapy and autologous transplant. So I think the community is anxious to see the results of this because this could be practice changing for the field. So definitely these 3 are on my list.